Have you ever wondered why the abdomen of your dog, by abdomen I mean this place that you call the belly, is distended or swollen? A term we call ascites in dogs. It's a very common occurrence, and most times when it occurs, people do not notice it until the dog stops eating or the dog dies. Join me as I take you on a quick expose on this um, disease or this sign in a dog and how you can prevent it or provide relief to the dog as soon as you can. So, this is a dog that was just presented this evening having ascites. You can see that the dog is finding it very difficult to breathe. Why? Because the abdomen is enlarged, it is distended. All of this is fluid, and this fluid, what it does is that all the vital organs like the liver, the spleen, the intestines, they are all floating around. So as it is now, the dog is unable to breathe very well. Why? Because all of this excess fluid is pushing back on the diaphragm and does not allow the lungs to expand properly or expand to its full capacity. So you see that the dog is having shallow breathing. He's trying to breathe, yes, but it's shallow. Why? Because of the amount of fluid that's in the abdomen. You can see the dog is not comfortable. The dog has been reported to be off feed for the past 2 days. Although the fly is just project, but it is needed to do an urgent intervention, and that's why we want to attend to the dog this evening. So, if you have this case in your house and a vet is not in sight, maybe it happened, you noticed at night, and your dog is weak and recumbent, and you want to quickly provide relief to your vet, this is what you do. You need essentially you need a cotton wool, you need a spirit, you need either a syringe or a cannula. Any of these that you have available that you can get can be used to provide relief to your dog. And what is this spirit used for? We just want to use it to disinfect the area where we want to go into the abdomen. Why? Because we don't want to take any bacteria from the outside into the abdomen. That space is supposed to be sacred. By sacred, I mean it's supposed to be free from any disease condition. Now, quickly, just to give you an insight as to what are the possible causes of this. The major cause of this that is known to us as vets is what we call a heart failure or congestive heart failure, right-sided congestive heart failure. Most times in dogs, especially young dogs like this, there is a worm that we call heartworm that is responsible for this. When the animal gets in contact with this worm, you know, within 2 weeks to 2 to 4 weeks, this condition develops. And for you that's a non-vet, it might be difficult for you to be able to ascertain this. But the laboratory tests that we use to do this, to identify this worm. So that's that. So apart from heartworm or heart diseases or congestive heart failure, other things that can cause ascites in your dog includes liver damage, includes spleen damage, includes what they call this, the bladder. If there's a rupture in your bladder and urine is seeping from your bladder into the abdomen, it can also cause this. Other than this, trauma can cause this, cancer can cause this. There's something we call abdominal peritonitis. That means the wall of the abdomen is infected. When it's infected, something we call protein losing enteropathies that can result from this. So, in all of this, you might not be able to identify which exactly is the cause and why it is happening. But if you are able to at least bring relief to the dog, you might just be able to save your dog's life. So join us as we try to um, remove this excess fluid from the abdomen. So the first thing I want to do is to Yeah. Thanks. Are you seeing the water dropping already? So with this, I want to remove the needle and push it in very well. Why am I pushing it in very well? You see, it's very common in dogs, and we just want to drain all of the fluid in the abdomen. When we are able to drain all of the fluid in the abdomen, you know, there will be relief. The dog will be able to breathe fine, and at least we'll be able to save the dog's life tonight before we ascertain the cause. So to ascertain the cause, what a veterinarian will do is to first take blood. When we take blood, we will do some kidney function test with assay for parasites. We equally do some liver function test and all of that. And why are we doing this? We just want to be sure that the liver is still okay. If the liver is not okay, we'll be able to detect that, from the profile, the blood profile that we've taken. If the heart is not okay, we'll be able to do that by auscultation. And if we want to check for these worms, for the heartworm, for example, we'll be able to assay that. Now, when we take the blood, we'll also take the urine. Why are we taking the urine? We want to be sure, or the content of the abdomen, we want to be sure that it's not coming from the bladder. So, if it's coming from the bladder, we'll be able to do that by doing X-rays or ultrasounds, just to be able to ascertain which of the organ is wrong. Don't forget, I told you, the first thing we think about when we see ascites in dogs, the first thing we talk about is heart failure, right-sided congestive heart failure. Other than that, we talk about liver damage. Other than that, we can talk about spleen, the damage to the spleen. Other than that, there's something in medicine called protein losing enteropathies, but that is a discussion for another day. Then we can talk about toxins, poisons. We can talk about cancer, and a whole lot that can cause ascites. So when you see swelling in the abdomen, it's not as easy as you think. The water is coming from somewhere, but it's not necessarily the water that the dog is drinking. So when you notice this in your dog, please rush and get the dog to a veterinarian. But when you cannot find a veterinarian, or when it happens, if there's an emergency and it's at night and you're able to get something to relieve the dog's pain, yes, you can go ahead and do this procedure that I just showed you. I hope that's clear. So come, let's see. the fluid. So now I want to take more fluid. I want to take more fluid. You can see, even with what I've taken, there's still a lot of fluid in the abdomen. We'll take water. As you can see, it's a clear fluid. There's no blood. It means we actually did not perforate any blood vessel. We are just in the abdomen. I said the fluid is still coming out. So it's more than if you don't take this out, the dog will not be able to have any. Sorry. So no matter how hard you push, this cannot perforate any of the internal organs.